Thank you very much, the moderator, and to the members of the Pharmaceutical Society of Kenya for the great work that you are doing. And us at Strathmore University Business School, and more particularly the Institute of Healthcare Management, we are always delighted to engage with you so that we are part of the conversation that is going on. So my honors today is very simple, and I would just request, I need to share a screen. Could we pull down this so that I share a simple screen here to spark the debate?
Sure.
Thank you. Thank you. So I will pick from where the current president had left, and I think he has really demonstrated to us what we should be talking about, and your role in the entire health system, which is very, very important. And for that matter, just to take a few minutes, and with these opening remarks, with Strathmore co-hosting with you this conference, a little bit of what is our healthcare financing profile. So what I will be sharing with you to help you as you go to the reds, the greens, the blues, this should be able to help us with the conversation, is to share with you a little bit of what we have been doing. I've been engaging with some of the members here for the ongoing deliberation, the debate, how we can influence policy, and then talk about how can we engage going forward. So with this, I just want to share with you 2 or 3 pieces of work that is on policy action that we have recently worked on. And one of it that we really need to rethink about, and you can get this online, is the Kenya health transition. As you are aware, we have donor transition, which is looming and is a reality. So how are we going to keep on financing our healthcare? So this piece, which we developed with the Global Center for Health Policy, a number of things for us to remember here, and I'm just getting some extract from this policy action paper, that we are currently facing several donor transition, and you are aware of this because you are in the industry. So how are we going to prepare ourselves in near future and also for the long term? But also the external sources of healthcare financing still plays a critical role. So we have found that in spite of the fact that we have this donor transition, but also we're going to face a number of challenges which we are currently facing. How do we absorb the donor funding programs so that we are able to finance our healthcare, and so that we don't have the situation where donors are, backsliding or not able to meet our service delivery. So this will be very important for us. So now into some of the details in terms of some of our takeaways that we will then think about, because this most recent, the actual data that we have done this study as have those captions of the analysis on those image. But on the opening remarks, we are at the bit of the out of pocket. We talk about the Fuliza, and what amount Kenyans are Fulizering at the moment. Some of that Fuliza is to buy medication, So now how are we going to think about the domestic financing of our healthcare so that positively we engage and we are able to sustain? But also, we are just, we are not out of the hoods yet, but emerging out of COVID, because that then has highly affected the economy. We have a lot of budget cuts. Some of the investment that were put towards UHC has been, redirected. So what are we going to do 2022 going forward so that we recalibrate our agenda for universal health coverage? But also, Kenya domestic revenue mobilization, what's our capacity? And from the pharmacy point of view, how are we going to shape the conversation? So again, we had opening remarks about the disease, about the NCDs now, the NCDs, the mortality rates in Kenya, and what is really ailing us. Again, main causes of death, where we spend, most of investment in healthcare, the aging population, and with this also we have to think about how will Kenya then improve on expanding access to essential healthcare, so that we're able to cater for communicable diseases, maternal healthcare, child, all these that, are big elements of our healthcare. But On the other aspect, so now beyond the Kenya Health Transition, which is a piece that we are engaging the government with, the other piece that has been done, that we have done in the Institute of Healthcare Management, and some of the names there, you are aware of some of these names, is this developing the financing transition, donor dependency and concentration in Kenya health sector, of which also part of a co-investigator in this. And what is emerging that we need to think about. So these are some of insights, some of the highlights that we then gonna use for our deliberations going forward. We are facing substantial declining, of financing while we are dependent on donor financing. So the data, is available. The other bit in terms of the treatment issues around TB, malaria, immunization, how are we going to change this conversation? But again, where is the financing concentrating? 90% of this financing, from the United States, from the global funds, around HIV/AIDS, tuberculosis, malaria, what Gavi, is doing with vaccines. But now the conversation around COVID and, are emerging communicable, diseases. But most ultimately, the question around ODA, so that we are able to finance all the aspects of our healthcare. So out of this, what we are suggesting for policy action is on proactively preparing for our transition, and then increasing the domestic resources in our financing, which you can go online, you can get this study, you'll see we have had some steady but minimal growth towards the financing locally, but it's still not substantial enough for us to finance our healthcare. But also, how do we continuously then engage with the key donors that have been supporting, so that the pathways for sustainability is clearly drawn, and we are able to finance our healthcare. But now, going forward, we are again engaging on a number of pieces, which some of the pieces have engaged with some of the members here across the counties across the country, from the secretariat, from other stakeholders, from the manufacturers, from the donor agencies. So, and we will be engaging you with this also as well. So we are currently on these three pieces where I'm also a principal investigator with my colleagues. We are looking at the impact of COVID-19, and how that affects, availability of essential medicine. So now this an ongoing study that we'll be engaging with you from next month when we have the output of this study. So we need to provide, recommendations, in terms of risk at national and county government level, so that we improve our preparedness for availability of essential medicine. The other aspect that we are doing is the health efficiency audit. This is a national study that we are doing, again, to ensure that we are able to sustain our domestic funding, for healthcare. So we are trying to document the concerns, the challenges, the opportunities, that we are facing as a country, so that as we transition from development assistance, are we able to, sustain and be and to provide to deliver services. But also another piece, that we are doing here again is our preparedness, towards implementing UHC. And now post-COVID, what are we going to do to ensure that the landscape, is positively influenced going forward? So now with that, as an institution, we will keep to engage with you on the areas of capacity building, on pharmaceuticals, supply chain, which we recently did a pilot with about 12 counties, and we trained a number of the chief pharmacists, and part of it is, for example, how do they mobilize resources. And now we are securing funds going forward to go to the 47 counties and go a little bit lower beyond the chief pharmacy, so that we ensure that everybody who is working in the space of pharmaceuticals and supply chain has the right competency, the right capability, so that we do our work effectively. And other than that, we're also developing a number of programs for the members, so that we continuously learn, because now the world where we are, we have to reskill, we have to retool, we have to unlearn. So Chair, with your permission, I beg to stop there, and then we will then engage further in the conference. So thank you very much.